Get the meeting recorded. There we go. Great. Thank you. Welcome, everyone. Happy Monday afternoon. Hopefully the sun's still shining in your neck of the woods for at least a few more hours. And if you haven't had a chance to get out and soak up a few rays before we get a week of clouds and showers, I hope you get to do that before the sun goes down today, because it was beautiful out. But let's dive in here. Couple of general updates, reminders that I wanted to share, and then I do have some items that I wanted to circle back to from last Monday and provide some additional updates and information on, and then we'll go to the Q&A. So definitely locate your Q&A icon, start typing your questions in there, and we'll try to get responses to all those live on the call today. We should have some time to get to the Q&A. So general updates that I wanted to share, this weekly meeting invite has been updated and should now show up on your calendars through Monday, June 3rd. As discussed at last Monday's meeting, we did decide to extend this meeting series a little bit longer because we do still have a volume of issues that we're trying to resolve, and we want to make sure that we can continue to give you updates on those. So as we get closer to June, if we feel like it needs to be extended out further to provide some additional support, we can certainly do that. But for right now, we are extended through June 3rd. You will also note that the meeting, which would have occurred on Monday, May 27th, has been moved to Tuesday, May 28th at 8 a.m. That is because the state of Maine offices will be closed in observance of Memorial Day on Monday, the 27th. So we wanted to make sure that we still could hold a meeting for you that week. So it will be on Tuesday at 8 a.m. I also just wanted to acknowledge, I didn't give an update on this at last week's meeting, but we are still working to finalize that new issue reporting form that we've discussed on some previous meetings. I didn't want you to think that we had forgotten about that. We are still working on that. There's been some internal review and some edits that have been happening on that. So we hope to have that out there for you shortly. I don't have a date for that yet, but just wanted to let you know that we are still working on it and that we haven't forgotten about it. In the meantime, I know we have been sharing on a lot of these calls, the Friday calls as well, and in the weekly emailed communications. At the bottom of those, there's a table that has some email addresses for different groups of individuals at ODES that can support you around different topics. So just as a reminder, if you're a case manager and you have specific case management related questions, you can email the hcbswaiver@maine.gov email address. If you're a provider and you have questions around provider authorizations, you can email the resource coordinator ODES@maine.gov email address. And if you have questions about an organization or location, either adding one or editing one, or you have new user requests or terminate user updates, or you're struggling with some specific items like being able to set a person-centered plan to complete, you can email evergreen.dhhs@maine.gov directly for those items. Some reminders specific for DD case managers and BI care coordinators. I have several reminders for you, but just wanted to make sure. I know they're going out in the emailed communications. I think they're going out on your channel in the Microsoft Teams, but I just wanted to make sure to remind agency support people, and if you can on this call, and if you can let your case managers and care coordinators know that we are requesting that they please continue to notify service implementation plan providers when they're being invited to submit or modify a SIP. Those notifications are still turned off while we're working on a resolution to the notifications issue. So there is no way for those providers to know that they need to fill out a SIP or revise a SIP unless the case manager or care coordinator is reaching out to them. So if you could make sure that they're all aware and that they're reaching out to those providers outside of the automatic notifications in Evergreen, that would be super helpful. Also, if case managers and care coordinators could please be sure to link services, needs, etc., like strengths, barriers, etc., to the goals in the My Life Planning section of the PCP before inviting a provider to submit the service implementation plan. That order of operations is necessary in order for those goals, needs, and everything to show up in the service implementation plan for the provider to be able to properly complete that SIP form. So if you could please make sure that you're following that process and linking all of the items under the goals before inviting the provider. That'd be great. And then also case managers and care coordinators, we need, I need to put a reminder out there, and it will go out in this week's weekly communication, but just a reminder that providers will never be able to submit the safety device approval packet in the system. That is going to need to be done by the case manager, community case manager, or care coordinator. And that is because the need for a safety device is documented as part of the person-centered planning process. And so the person-centered plan is authored by the case manager or the care coordinator. So because of that and the need to document that in the PCP, you would then, as a case manager or care coordinator, need to follow that up with the creation and submission of the safety device approval packet. The provider will still populate the request form, the device request form, and get the signatures from the doctor or guardian, but they will then send those to you or share those with you so that you can document the need for that device in the PCP and then create that device packet and attach that request form and submit that for the person. So that will be a function. Safety device approval packets will be a function of case management care coordination in Evergreen. And then the last reminder for that group is to please be sure to continue to submit behavior management plans in Evergreen. And providers still can't do that themselves. We are working to resolve that, but they can't currently attach any of the required attachments for the BMP. They can't see those right now because of the attachments issue that is outstanding. So we do need community case managers or care coordinators to support the submission of behavior management plans until we're able to resolve that issue. There are also a couple of workarounds that I believe Angela Faulkner and her team put out in the case management channel today. So I did want to share those on this call as well. And I will also upload these. I didn't get a chance before this meeting, but I will also upload these into the Evergreen Help Center. But I wanted to share them on this call. Oops.
Leslie, one is a workaround and one is just guidance.
Sharing my wrong screen. Okay, yeah, workaround and guidance. Yes, thank you, Nancy. So this one's the workaround. Hopefully you can see this. Sorry for sharing the wrong screen the first time. So this is the workaround for the issue that people are experiencing with the person-centered plan when it's telling you that you have not met the guardian signature requirement. So there are a few steps here, and there's a little screenshot. And again, I will upload this into the help center of Evergreen after this call, but just wanted to share it on this call as well. So the steps are, if you believe that your plan is complete and your completion requirements are saying that your signatures are still not met because of the guardian signature not being there, but you can't actually put the guardian signature on there, even though you have that private guardian as a contact under the person record, you should follow these steps. First, you should review all of the person contacts that are under that person record, and any that have a role of private guardian, you need to uncheck the role of private guardian and check the role of emergency contact. Then after you've done that on any contacts that have that role of private guardian, then you're going to go back into the PCP and you're going to use this little ellipses, 3-dot ellipses, and you're going to see a sync option under there. And you're going to click that sync option. And then that, and please note that that's only going to show up when you're not in edit mode. So your edit mode button will look like this with a gray dot instead of the orange dot. If it shows the orange dot, your sync won't show up here. So you need it to be in this view mode or not in edit mode with the gray button. And then you'll see the sync, and then you'll use that sync. And once you do that, your completion requirements should update to met. Then you can set the plan to complete. And then once you've done that, you're going to want to go back to your person contacts and add that role of private guardian back and remove the role of emergency contact. Doing this will make it so that the next time when you revise the PCP, it will recognize that guardian contact appropriately, and it will require the signature appropriately, and it will give you the signature box for that. So hopefully those are you follow that and you understand that. And again, I'll put these in the help center for you as well. The guidance document is for how to revise a SIP for providers so that they can edit when the PCP is still in progress. So we had heard from a few of you that the PCP was still in process. The provider was invited to submit their SIP. They completed everything and they submitted it for the person's review. And the case manager was reviewing with the person, but needed the provider to make some edits to that service implementation plan before it could be set to plan implemented. So these are the guidance on how to do that. So the first step is, again, that the case manager would have invited the provider to submit the SIP. The SIP form is auto created by the system under the SIP tab so that the provider can complete their content. And then they would, at that time, the SIP would be in a status of in progress. And then the provider will complete that SIP, double check to make sure that it's accurate before you complete that as a provider, set the status to submit for review. When the case manager is reviewing the SIP with the person and or guardian, if you require changes to that service implementation plan, you will go to that row on the SIP tab, and to the far right, you'll use the 3-dot ellipses, and there will be an option of revise. When it's in that status of pending review, you'll have that revise option under the ellipses. So you can simply just select revise, and the system will automatically reset your SIP to in progress. This will then allow the provider to make modifications. And then once they've made the modifications that you've requested, they can set the status back to submit for review. And then you as the case manager or care coordinator can review that updated service implementation plan with the person guardian, make sure that it's accurate and complete, and that it's captured all of the edits that were requested. And then you can set the SIP to the status of plan implemented. And then once that's done, once all of your SIPs are set to plan implemented, as the case manager or care coordinator, you can go ahead and complete the person's SIP survey portion of the plan, collect the signatures, and then you can set the PCP itself to a status of plan completed. So again, I will upload these set of instructions into the Evergreen Help Center as well, but hoping that these 2 items were helpful for you. They also, I believe, were shared out in the Microsoft Teams channel for the case managers and care coordinators earlier today.
Leslie, just to update real quick, Udaya is aware, and I am aware, that the state case management role does not have that revise button. So Udaya is aware of the issue. This will definitely help all the community case managers, but state case managers, and I don't know about BI care coordinators, care monitors, where they're at with that. So they could report that if it's an issue, but we are aware that state case managers do not have that revise button.
Okay, That should be hopefully just a permission that Jean
Right.
can add. Okay.
I think we're waiting for Jean to get back today.
Yeah, okay, thank you. Just making a note of that.
Where are you?
All right, so just a couple more things before I go to the Q&A. I do see we have some questions queuing up in the Q&A. That's fabulous. Just some follow-up from Monday's meeting, the May 6th meeting. There was a question from Brianna regarding when the fix for having two PCPs open at the same time is expected to be resolved. I don't have a great update for that yet, Brianna. I did follow up on it. It looks like I need to take a review of that and work with the vendor on it. Apparently, they have implemented it the way that our requirements indicated it should have been. So I need to do a little bit deeper dive on that. So it will not be part of this week's deploy, and very likely would not be part of the May 31st deploy. It will probably be at the earliest, but in the first June deploy, which would be about the middle of the month of June. But I'm gonna do some more follow-up on that and try to figure out what's going on and see if we can't escalate that a little bit faster for you.
Leslie, we did do
yeah.
some workarounds around that. No, well, just some guidance. You want me to
Okay.
share that real quick?
Yeah.
Yeah, so for those that are requiring a 90-day review, we've suggested that you just document somewhere, either in the annual plan that you've revised to open that you're working on for that like 90 days. You could note in your meeting minutes that the 90-day review took place and a date that it took place. Or or in your progress notes, you can reflect that you completed that 90-day review. If it's for a change in service, you have two options. One is to wait until that annual plan. If it cannot wait, though, your other option is to close that annual plan that you have sitting there that you're trying to work on in order to revise the plan to do a change in service type. Get that one completed and then open up for your annual review. It's not ideal, but it's the only thing we have right now.
Thank you, Nancy. And I will look into it further and see if there's something that we can do to get that updated sooner for you guys. Lisa had asked on the 6th what the time frame was on getting the attachments tab back. I am hopeful that that will be by May 31st. I can't make any promises, but I know the vendor is working on it. I believe we are going to be able to start testing on it very shortly, and hopefully it will pass testing and we'll be able to deploy it with our May 31st deploy. And Allison had reported that the reportable event provider notification was not going away. I did get some additional follow-up from her on that with some screenshots, which were very helpful. Thank you, Allison. It looks like where Allison was still seeing that notification was on the person dashboard, that it wasn't dropping off the person dashboard. So I do need to do a little bit more follow-up on that, but the screenshots were super helpful. So I just wanted to acknowledge that, and we'll let you know once we find out some more on how those drop off the person dashboard. How and when, and if there's a bug, we'll get it worked out for you guys. But I also wanted to acknowledge Anne Marie had chimed in under that same topic and said that she was receiving a reportable event notification, a provider reportable event notification for a client that was no longer with their agency. So I didn't address that on last Monday's call because I think it was towards the end of the meeting, and I wasn't aware that or I didn't see the distinction there that Anne Marie thought that she was receiving a reportable event notification for a client that was no longer being served by her agency. So I did want to say, I don't know if Anne Marie is on, but if you are Anne Marie, it would be super helpful if you could send us an email at evergreen.dhhs@maine.gov with the person ID, reportable event ID, and your organization name, with a description of that problem. And I'd have the team look into that, because my guess is that one of your locations is still actively assigned to that person record and needs to be inactivated. So I don't see Anne Marie's name. Oh, yeah, it does look like you're here, Anne Marie. So hopefully you can send me that follow-up email and we'll get that resolved for you.
I will. Thank you, Leslie.
No problem. And then there was some conversation towards the end of the meeting as well around the progress note rounding rule. And I did want to follow up on that as well. I know that's come up several times. I think there's been some direct email response related to some questions on that. And I have a little bit more succinct response to that question. So based on some correspondence that I had with Office of Maine Care Services last year, early last year, so it's been a little over a year ago, the determination was, or the discussion was, that the Section 13 rule supersedes the Section 1 rule, and therefore users of, at that time, EIS, but now Evergreen, in accordance with Section 13.09-1, if a provider delivers less than 15 minutes of targeted case management, they can bill for the whole 15-minute unit. If they deliver more than 15 minutes, they can bill for the 1 unit plus any partial units in accordance with the rounding rule, but cannot bill for that second whole unit. If the rounding rule does apply, then users should use the Evergreen hours and minutes that are captured in the general progress note to determine the correct number of units to bill for. So I know that the system does not round to the second unit for you in accordance with this 60% rounding rule, but you can, as a case management agency, you can in your progress note determine the correct units to bill for, partial units to bill for, based on that hours and minutes field. And there was a rounding rule e-message that was sent out by the Office of Maine Care on January 3rd, 2023, that has additional details, and there's some frequently asked questions, specifically numbers 11, 12, and 14, that are relevant for this group. So I'm going to put this information and the link to that rounding rule message in the chat right now for you. So if you want to go find some more information on that, you certainly can. It does reference EIS, but you can basically plug and play Evergreen for EIS, and it does indicate that Evergreen would be available later, but I think the content is still relevant. And then the only other item that I wanted to circle back to from last week before I go to the Q&A was we had some conversation around medication review dates and how that worked in Evergreen. So I did want to just follow back up and share with folks how that works. So in Evergreen, in the person-centered plan, there is a section called medication review dates. I believe that's the title. Let me just confirm that. I don't want to give you misinformation here. Yeah, the section header, it's under the My Life Planning section. It's a subsection, and the header is medication review dates. This section of the PCP is a multi-add list, meaning when you go into your PCP, you'll see a little plus medication review dates button. And you can use this button to add as many different medication review dates as necessary for the different types of medications. So there are 3 types that can be captured there: psychotropic, medical, and other. If you choose other, you have to provide some text on what the other type of medication is, but you can add each medication review date to the PCP. Once you've done that, the comprehensive assessment, when you go to do an annual, will display the medication review date details that you put in your most recent PCP for your review during the comprehensive assessment. And then once you've completed the comprehensive assessment and you go to the PCP, you can revise the medication review dates. So you can add or remove medication review dates from that section using the plus or minuses. And then also in the comprehensive assessment, it will pull exam dates for medical, dental, and vision from the appointments and meetings module of the person record. So hopefully that provides a little bit of additional clarification on how that content is captured and where it's displayed. I think that was all I wanted to circle back to. So with that, let me grab the Q&A here and we can start answering some questions. The first question is, are you still working on giving the provider agencies sole access to the service location addresses again in the service implementation plan? Yeah, great question. This information in Evergreen is gonna repopulate. It's gonna be, unfortunately, we won't be able to give the providers access to select their own service location address in Evergreen. And the reason for that is because the waiver service itself is added in the PCP. And so the community case manager needs to select the waiver service. And then in order to invite you to submit a service implementation plan as a provider, in order to invite you, they need to select the appropriate location so that it will auto create a service implementation plan for each unique service and provider location combination. So unfortunately, this will continue to be a case management care coordination function. So it will be important that they know which service location to select when they create your SIP. If there's an error with that, if the case manager invites you to submit the service implementation plan with the wrong location, you should reach out to them and let them know. Don't fill out the SIP with the wrong location. Just reach out to them and let them know so that they can manually close that SIP that has the wrong location and re-invite you using the correct location. There's a question. Yeah.
You don't have to close that SIP, I don't believe. They can just go to the bottom and uninvite that provider with a minus and then plus that provider back in.
Thank you. Sorry, Nancy. Yeah, sorry. The case manager won't have the close function on the SIP that, as Nancy indicated, you'll have to, as a case manager, you'll have to go to that particular waiver service and remove that provider under the invitation section and then re-add them using the correct location. And then that will auto create the new SIP. Thank you, Nancy. There's a question about where questions regarding issues of entering safety device requests into Evergreen should be directed. It's a data entry question, not a process question. So if there's a question about how to populate a safety device, approval packet, that should probably go to the crisis email, but it will need to be very clear that you're asking a question on how to populate the packet. You can't just submit the packet to that email address. They're not accepting submissions through the ODES crisis email anymore. Only for ICF, Section 50 ICFs, IIDs. So if you're not a Section 50 ICF IID, then you do need to submit your safety device approval packet through Evergreen. But if you have a specific question on how to populate that, then you probably should reach out to the crisis team. It's my understanding that the approval packet process is exactly the same. None of the requirements have changed. Like, you're required to submit all the same data and attachments and everything. So I'm not sure what the question might be. If you are on this call and you have the specific question, I would happily try to answer it or take it back as well. There's a request for updates regarding the safety device plan packet. It requires something to be uploaded as an approval form, even though it can't be approved until after it's submitted. Yes, so I think the safety device approval packet requires an approval form. So it's my understanding that you need to upload a blank approval form, attach a blank approval form to that packet so that it can be submitted, and then the committee will review and add their approval to that document and re-upload that document to the completed packet. There's a question about how long the state review should take. I don't know, Emily, if you're on, or Alexi or Donna, if you guys know if somebody's on that can answer that. I don't know if there's been any specific time frame that's been shared around that.
Leslie, it's Donna. Was multitasking. I heard about a time frame, but I didn't hear
Yeah.
what specific.
They're asking about the state review time frame, the PCP
Okay.
review
We
time.
we don't really have established timeframes yet. We're still working through things as quickly as possible. What I will say is that the resource coordinator team, their priority in their work is initial classifications first, and then annual classifications. With annual class, or sorry, with initials and some of the annuals, they have to do the PAs that go with the new PCP, changes in waiver service, and state reviews. So it's not that we're ignoring them. We're trying to keep everything within reasonable timeframes. But it is taking longer. We are reviewing PCPs twice now instead of just once. We're entering PAs a little more often than we were before, because PAs are tied to the PCPs now and not just a rollover process. So we're taking longer than we used to. We hope to have a better understanding what the timeframes are going to be, but we're still just 3 months into it. So give us another 3 months. Hopefully we'll have a better understanding by then. Thanks.
Thanks, Donna. Lisa is asking when the billable notes report will be available. I had hoped, Lisa, that would already be resolved, but we do have a lot of report issues and competing priorities around that. So we are still emailing you out the billable notes data each month. You guys should have all of the data through April at this point. If anybody feels that they don't have that, please let us know. But I know that those have been sent out through April. There is a question, or maybe a statement. I think it's a question. To complete a goal, we fill it out, then invite a SIP provider, then we go back into the goal and choose the correct services and supports. The provider can't see the invitation unless we choose them under services and supports. I think there's some confusion, Alyssa. I don't think I don't have anything staged to show you how this works, unfortunately, with production system and PHI. I can't really share my screen and show this very clearly, but essentially what you should be able to do is work your way through the PCP from the overview section. Sorry, let me get my terminology correct here. I don't want to give you the wrong information, but the first section of the PCP is the overview. That's all going to be displayed to you. And then you would complete the personal profile section and its subsections, the exploration and discovery section and its subsections, which is the domain-based getting the life I want. You'd populate the My Meeting information section. You'd populate the My Circle of Support section, and then you would get to the My Life Planning section of the PCP. In here, the subsections are My Life Planning Person-Centered Thinking Tools, which is informational, and then My Goals, My Goal Review, My Needs, My Strengths, My Barriers, Services and Supports, Summary View. And the summary view will only show up when you're in view mode, not in edit mode. And then changing waiver services, state review, and then medication review dates. That's sort of the order of that section. So when you get to the My Life Planning section, it's recommended, so your My Goals section will display goals that were captured in your exploration and discovery, getting the life I want section or personal profile section. I'm sorry, I can't remember which one it comes from, but anyway, the
So
goal names.
if I can jump in real quick, because I understand the process, I don't want you to have to relay too much. So to save a goal, we have to put in the services and supports. And if there's no item available because we haven't invited the SIP provider, we cannot click save on the goal. Does that make sense?
I think I'm following you. So you have to have the services and supports, the waiver services and supports added in order to edit and save your goal, but you shouldn't have to invite the service provider first. So you'll need to populate the waiver services, but you don't need to add a provider or invite a provider. You can just have the waiver service filled out in the services and support section. And then you should be able to edit your goals and link the service from your goal. And then you should be able to go back to your, once you've done that, once you've edited your goals and linked your services, needs, strengths, barriers, put your key milestones in and all that jazz, then you should be able to go back to your services and supports and under the waiver service, invite those providers, and then it will auto create your SIP. And on those SIPs, it will show the goals with all of the correct needs, strengths, barriers, services.
So, but we can't add a service and supports without adding a service implementation plan provider invitation. So like when we click provider next to the service, it says no option available. And again, you can't click save. It says fill it out.
Yeah. So I think that thank you. That's where you're getting a little confused. So you should be able to add a service, a waiver service, and not populate the provider. Don't populate the provider. Don't try to populate the provider field. Literally just add the service and the units that are being requested and don't select a provider and then you don't have to invite a provider. Does that make sense? And
You do
then
Makes
have-
sense, but I'm still getting an error message.
Leslie, you do have to answer the question. I do not need these supports when, or whatever that question is, because there's a yellow line. Yellow lines are required to save. So you do have to work your way down and answer that one question. It's the finish the statement. I no longer need these services and supports when.
So maybe that's why you're getting the
That-
error.
I would ask
Alyssa.
Alyssa to try that and see if she can save it then.
Try it now and see.
While you're doing that, Alyssa, I see your other question about why you can't see all of the questions. I think you mean the questions that are in the Q&A. I don't believe you as a participant can see them until they're responded to. I think you can then see them, the answered ones. I don't know. Esther may or may not know. She's not normally our Zoom host.
I'm not sure.
I think you should be able to see the answered ones, Alyssa, but you won't be able to see the unanswered ones.
Okay, so I can save the service and supports.
With
Um,
provider and without inviting.
and then I add them to the goal.
Then you want to link them in the goal.
Yep. And so how does the provider, after I do that, so then I do the invitation and I
Yes.
should see everything?
Yes, once you get the goals completely filled out with your service link, your needs, your strengths, your barriers, your key milestones and everything. Once you get that completely populated, then go back to the waiver service and invite the provider. And then when you do that and the system auto creates that SIP, the SIP will have that goal and the linked service or services and the linked needs and everything displaying in that SIP for them.
One
Can I just
caveat,
ask a clarifying question? Sorry.
can I say one caveat to that, please, before we go on? Is that if it's a new service, we should not be inviting providers until we've gone through state review and it's set to pending provider selection.
Yeah, thank you, Nancy.
And whoever had something to say, they can say.
Yeah, I think Megan had a.
Yes, it was sort of related to that. So yeah, I was going to ask about the state review, and if it was a new service, but what if it's an annual? What if it's an annual plan? Do we still have to wait for it to go through state review before inviting the SIP provider?
Yes, I believe that's the guidance. I don't know, Donna, if you want to chime in.
It's best practice to do that if you're running tight on time. Because we want to make sure that the services and everything are still aligned, checked to make sure that there's not going to be any issues with the PAs and all that before, or with the plan before you start adding the provider stuff in there. So if you can make it work so that you can do that soon enough for us to have time to get to the review, then we preferred it. But if you've got providers in there, we can still do the review. Just do not move it past pending provider selection. If
Okay,
we
that's-
prefer to keep it in pending state review, but definitely if you inadvertently move it forward, but just don't complete it without.
Okay, that's good to know, because
Yeah.
I submitted, I'm working on an annual plan and I submitted for state review on 5/1. And it's effective later this month, and I'm just want to give the providers enough time. And I'm thinking I'm kind of want to invite them to start working on their SIPs.
You may want to do that. You also just may want to tell them it's coming soon. It's in state review and they should be starting to work on it. I mean, they know what the forms look like. If not, they can get it off the provider page on our website and they can use that as a mock-up and then they can copy everything into it later.
Okay, thank you.
Thanks, Megan. Thanks, Donna.
Leslie, I just wanted to say one thing quickly too. When you're doing an annual revision, then you're going in and revising those SIPs. Just, these are processes we haven't really had a chance to work with people on yet.
No, I don't think they're revising the SIPs, Nancy. I think they're brand new ones get created.
Okay.
Yeah.
All right, yep, then that's something that, yeah, no worries. All right, thank you.
Yeah, I'm pretty sure it's I'd have to confirm that. I don't want to misspeak, so
Yeah,
don't quote me on that, but I'm pretty sure it's creating brand new ones.
Yeah, let's take it back then, because I want to make sure I'm guiding people correctly too, and we just haven't really gotten to that place where we're doing that consistently.
Yeah,
So
yeah. I'm 99.99% sure that it's creating brand new SIPs that are empty and need to be filled out for annual planning.
Okay,
I'm just tracking a note on that so we can review. All right, so there is a question, is there going to be a time when CCMs will be able to delete redundant entries? For example, I have a client who has 7 entries for the same phone number, and those kinds of redundant entries make that section of the person record very confusing to process. You should be able to, as a community case manager, you should be able to modify the person record. So if there are duplicate entries of like a phone number or a contact or those types of things, you should be able to clean that up. Now, keep in mind that other user roles also have access to the person record. So like if there's an actively assigned public guardianship representative, those individuals also have access to edit those areas of the person record. So you guys might be, overriding each other if you aren't in agreement on some of that data. You might delete something and then they might add it back, or you might edit something and they might go back and reverse it if you guys are not in agreement on that. There may also be a situation where it appears that there are redundant entries. We did migrate data from multiple sources. So some data came from EIS, some data came from MIMS, some data was already existing in Evergreen. So there were some matching and deduplication efforts that occurred so that we would not be creating duplicates, but there may be some instances where some duplicates did get inadvertently created, but you should be able to clean that up. So if there are specific examples,
Leslie, we
Yeah.
should take that back and talk about it because this has been an ongoing issue. I don't believe with the requirements, they're allowed to delete them. They can end date them, which puts them to the bottom. But
okay.
we're talking about, and I had this on our agenda with Udaya and you and I and Lisa too. So you want to just take a note to talk about this? We'll look
Yeah.
at it.
Yeah.
I understand the
You are
issues that
right,
there are.
actually. I think they can only end date them, but there's a lot we want to get cleaned out of there, it sounds like.
Yes. We had
Okay.
talked about it initially once, but so many pressing issues that
Yeah.
that's gonna have to be a while. I'll talk to you more about it when we talk about it though.
Yeah, no, that's good. I'm glad that it's being brought up. I don't know. I don't think Emily is on the call. I know Donna's been trying. Oh, actually, I did see she was typing. Emily, this might be something that we could, oh, maybe she's not here anymore. I don't see her name. She might have dropped again. Oh, no, there she is. Emily, this might be something that we could, you leverage our data contract with Maximus on. So
Yes, I was thinking the same thing. Sorry, yeah, I was on and then lost connection. So I have not been here sometimes. So you're not you're not
No.
losing it.
Exactly,
Um,
guys. I actually have talked to Doreen about that already, so she's already
Okay.
aware of that, the possibility for that crew.
Okay, excellent. Yeah, if we can create some sort of a data set, that would be excellent project for them to help us with.
I think that's the difficult part is what do you keep, what do you get rid of, so I think that's gonna take a team effort.
Yeah, I mean, definitely duplicate records, like we can confirm that this phone number exists and is still on the record, or this contact exists and is still on the record, then I think those could definitely be cleared out. If there's not a duplicate, then we might want to keep the inactive record just for historic purposes. But yeah, we should schedule a separate meeting to kind of work through that together. There's a question about who do we talk to about setting provider and location permissions? And is there any guidance about what specific permissions each type of provider should have? Example, a residential provider would likely have different permissions than a day program. Interesting. Okay, so any access related, permission related questions should definitely go to evergreen.dhhs@maine.gov with as much detail as possible around what organization, what location or locations, what users you're specifically inquiring about. We have several provider roles. Those include reportable event provider, provider authorization provider, PCP data entry, which is our service implementation plan provider role, and possibly a couple of others that I'm not remembering right offhand, but those are the three major ones. So your users would be assigned one or more of those roles depending on what level of access they need. But I don't believe, and again, this is just offhand and off the top of my head, I don't believe that there would be a different or a distinction for a residential provider versus a day program provider. I think your users would have the same level of access, just depends on their specific function within your organization in that location. Should they have just reportable event access? Should they have reportable event access and provider authorization access, or are they service implementation plan providers who should be filling out SIPs? So definitely send your questions to evergreen.dhhs@maine.gov and we'll try to help you get those roles, those users' roles updated accordingly. Now, I will also just take a minute to say there's been a request and we're still working on, there's just, again, so many competing priorities, but there's been a request for us to provide a sort of a one-pager on what level of access each of those roles have. And I explained at a meeting probably 3 or 4 weeks ago now that that's just a little bit trickier than it sounds like on the surface. Each of those roles has lots of permissions. So trying to distill that down into something that's digestible is pretty tricky. So we haven't lost track of that request. It's just going to take us a little time to pull that together.
Thank you for the answer. Sounds good.
You bet. There's a question about will new providers for a person still need to submit the SIP on paper? Yes. For right now, that issue that is preventing new providers from populating the SIP within Evergreen still exists. So brand new providers do still need to fill out the service implementation plan on paper, provide that to the community case manager or the care coordinator, and they will attach that to the SIP form inside of the PCP on the SIP tab in order to complete that initial service implementation plan from that provider. There's a question about, is there guidance on what sections need to be completed before we send to state review? I don't know, Donna or anybody, if you guys are comfortable responding to this, but I think, you know, the guidance that I would provide is following the person-centered plan manual. I know we're still working to update that with Evergreen terminology, but I think it's updated enough to indicate sort of which sections of the PCP would be populated prior to setting it to state review. I don't know if you want to add anything, Donna.
So when we're doing a state review, we're looking at the waiver services, not the provider stuff, but the specific waiver services. We're looking at information on the person, background information, their goals, what they want in their life, you know, we're looking for health, safety, and functional needs and goals of the person, and making sure that those services make sense to help that person get through, you know, achieve their goals, or at least work on them and get as close to them as possible, live as independently as possible, things like that. And we usually ask that the PCP meeting summary be done as well, because that's always another place to document. If there are changes in the plan for any kind of PCP type, please use the change in waiver service page as if it was the old authorization request form. Put yes if there's a change in waiver services, put no if they're keeping the same services, it's an annual plan or an initial. And then if there are changes, please tell us what. Community support increasing from 13.5 to 20 hours a week, changing shared living oversight agency from ABC agency to XYZ agency, things like that.
Thank you, Jonna. Yeah,
Thanks.
that's super helpful. Yeah, I would say, and again, I don't want to overstep, so please correct me if I'm wrong, Donna, but you would, you know, at the time that you set it into state review, you should have had your PCP meeting. So you should have the personal profile section, the exploration and discovery section, the my meeting section, the my circle of support section, the my life planning section, and anything related to rights, supports, and modifications, as well as Donna was saying, the meeting narrative summary, the summary of meeting section. Those should
yeah.
be populated before it goes into
Yeah.
state review.
And I want to give everybody a shout out, because probably 90-95% of the plans that we're reviewing for state review are there. So
awesome.
y'all are doing a great job with that. Thanks.
Yay, yay. Kudos to everybody. So I do see we're a few minutes to 5 o'clock. I do have one more question in the Q&A, which is, will we have a session the Tuesday after Memorial Day, since Monday is a holiday? Yes, Megan, we will be, and I think it should already reflect on your calendar. If it doesn't already, we will get that updated. The Monday, May 27th meeting will occur, which would have occurred on Monday, May 27th, will actually occur on Tuesday, May 28th at 8 a.m. So that is the only one that is expected to be off schedule because of the Monday holiday, the Memorial Day holiday. I don't see any more questions in the Q&A, and we are just a couple minutes to the end of the day. So I will say thank you again to everybody for joining. Hopefully you found this session helpful. I will be sending out a weekly email communication. It will be chock full of information, mostly what was shared on this call, but just to keep your eye out, and that should go out to all of our end users. So all of your agency coworkers and subordinates and that kind of thing should receive that communication, hopefully no later than Wednesday. I know I always give you a date and then I never meet that. So let's see if this week I actually can. But thank you again for joining, and everybody have a great day, and quick run outside and soak up a couple of rays of sunshine before the sun disappears for a few days.
Thank you.